Welcome to Dear Dr. Mao. Today I'm going to talk about what does your fertility say about aging. Later on in the episode, I will show you how to use fertility tests for men and women as a measure and marker for how well you are aging, even if you're not planning to have any children, and also provide tips on how to improve your eggs and sperm quality and quantity, especially if you're at what is called advanced age. It is a well known fact that as you get older, your ability to procreate and produce offspring diminishes. Of course, we also know couples who are much older that conceive and have kids with what it's called advanced maternal and paternal age, with their own egg and sperm. So, is there a correlation between fertility marker and how well you're aging? The answer is a resounding yes, and studies confirm this fact. Now, what if you don't care to have any children? Are these markers still useful in measuring your rate of aging? Absolutely. And even if you're not working on procreating, the fact that you remain fertile and virile directly reflects your biological age and not your chronological age. So let's look at fertility parameters for women and men. But first, start with women. Later on, I'll discuss the male fertility parameters. So for guys watching this, don't go away. Stay tuned. Typically, a woman is born with roughly 400,000 eggs, and by the time she reaches menopause, there are about 10,000 eggs left, although pretty much the whole lot is not viable for pregnancy due to degraded quality of the eggs. Correspondingly, her hormonal system changes with age, and with estrogen, the hormone that's responsible for healthy lining of the uterus, and progesterone, responsible for the monthly sloughing off of that lining, declining over time. The function of her ovaries also decreases with the rise of the follicle-stimulating hormone level, which comes from the pituitary as a signal to the ovaries, and when that level rises, it tells us that the ovaries are not responding as well and is sluggish in its function. There's also another hormone called anti-Mullerian hormone, or AMH, that measures ovarian reserve, meaning how many more eggs are left, although it doesn't tell you what the quality of the eggs are. Taken together and looking at the historical rate of changes in a woman's hormonal levels can help predict how quickly she is aging. Of course, one common indicator of your egg quality is your age. Sadly, a woman's fertility declines slowly until age 30, then accelerates at 35, and then very quickly drops precipitously by 38, and pretty much by the age 45, it is commonly agreed by experts that there are no viable eggs left. This is why when a woman wants to bank her eggs, meaning freeze them for later use, she should do so by age 38 or ideally younger. I know this is not good news for you if you're older. However, don't despair. Help is on the way. Chinese medicine has long recognized that fertility is a good measurement of aging, and that slowing down and reversing the aging process can also extend a woman's ability to procreate longer. Now, we have worked with many women that were so-called at advanced maternal age, which begins at 42 and older, and have seen improvements in all the parameters I mentioned earlier, including FSH dropping, showing that the ovaries are working optimally again, and AMH level increasing, which indicates improving ovarian reserve, as well as better egg quality is determined by ultrasound imaging and genetic tests. Additionally, there's another measurement called DNA fragmentation, which is the result of all the toxins in the environment that accumulate in your body and degrades the quality of both eggs and sperm, rendering them useless. With our protocols, we have also seen the rate of DNA fragmentation decrease substantially. Obviously, the proof is in the pudding, and over close to 40 years, we have successfully helped thousands of couples achieve their dream of having children when the odds were low due to advanced age of their parents. Now let's move on to men. You may think that you're aging just fine. However, here are the signs of low testicular function. Well, fatigue or low energy, erectile dysfunction, low sex drive or libido, infertility, anxiety, depression, brain fog, meaning declining in memory and focus, enlarged breast tissue, bloating and weight gain around your belly, headaches, blurred vision, hearing loss, loss of bone density. Not suffering from any of these symptoms I just listed? That's good. It means that you are aging well. But for the rest of you, especially when it comes to male fertility parameters, it's all about the sperm. Sperm is produced by your testicles, and aging takes a toll on the sperm quality and quantity. There are three things we measure: sperm count, motility, and morphology. Sperm count shows the concentration of your sperm per ejaculation. Average sperm count at age 21 is over 200 million. However, studies show that each year thereafter, there is a decrease in sperm concentration of up to 3.3% per year. So no wonder by the time you are 40, the average sperm count is less than 50% of what it was when you were 21. Well, it's hard to admit that you are now no longer the stud you once were. Motility shows how many are still swimming after an hour, meaning, are your sperm still swimming? Incidentally, it's a long way for the sperm to swim to find the egg, something like a snail making it across the football field. So if you've got low motility, it means that most of your sperm simply aren't swimming. And by the way, for those men who are still smoking pot regularly, studies show the potheads produce sperms that move very slowly or not at all. In other words, stoned sperm just want to veg out and hang ten. So be careful, you are what you smoke. Then there's the morphology. Morphology measures the normal appearance of sperm, meaning head, neck, body, and tail, and how many normal-looking versus abnormal-looking sperm there are. If any of the parts are defective or missing, then that sperm is not viable and will not fertilize an egg. Obviously, it only takes one good sperm to fertilize a healthy egg, so why do you need so many millions of sperm? Well, remember my snail crossing the football field? It's a long and windy road to nirvana, and most don't make it. Only the strongest swimmers will get there, and then only the lucky one will get to fertilize the egg. So nature designed this so that the race starts out with over 200 million sperm, and well, at age 21 anyways. And by the time the race is over, only a small group will arrive at the finish line. So if you start out with less, take out the slow and lazy ones, and also those that are, well, defective. Your chance of pregnancy is a long shot, no pun intended. When I see male patients with lower sperm parameters than I expect at their age, it tells me that aging hasn't been too kind on them. So using the direct correlation of sperm as a marker of the aging process, I'm able to evaluate and put patients on an age reversal protocol, which happily shows up not only in higher sperm count, motility, and morphology, but also improvements in energy, muscle strength, libido, erectile function, cognition, and bone health. Let's talk about what you can do to improve your fertility parameters. Ladies first. Number 1, eliminate environmental toxins because they act like free radicals and negatively affect both the function of your ovaries and the DNA of your eggs. Number 2, eat and take antioxidants, lots of them. For example, the skin of blueberry, blackberry, and plum contains anthocyanin, which protects tissues from ROS, or reactive oxygen species, commonly known as free radicals. Chlorophyll from leafy green vegetables like spinach, collards, and chard, detoxifying sulfur compounds from crucifers like broccoli, cauliflower, cabbage. Number 3, take fertility-enhancing herbs like morinda root, or commonly known as noni, ovarian support cypress root, and hormone-boosting selenium seeds. These herbs can be found in Spark Male Formula, available on Dowstar.com. Now for the gentlemen, number 1, stop killing your sperm by keeping your scrotum cool by wearing loose-fitting boxers and pants, avoid hot baths, shower, and jacuzzi, and stand up at work. Avoid sitting for prolonged periods of time. Remember, there's a reason that your testicles are outside of your body because it needs to be at least 1 degree cooler than the rest of your body. Number 2, eat lots of seeds and caviar. A tree 30 foot tall and 4 foot wide began as a single seed. Seeds contain all the ingredients necessary to produce a life. Sperm are just like seeds, so enhance your sperm quality and quantity by eating sesame, flax, chia, hemp, sunflower, and pumpkin seeds. Besides the protein and fatty acids, seeds are full of minerals like zinc that are essential for testosterone health. Also, small eggs like salmon roe, sturgeon caviar, and quail eggs are helpful too, as each little egg contain the potential for a life. Number 3, take herbs that enhance male fertility, such as libido boosting epimedium or horny goatweed. Motility enhancing Chinese ginseng and testicular support Chinese chive seeds. These are other herbs that are found in Spark Male Formula, which can be purchased on Dialstar.com. Whether you are looking to increase your chance of pregnancy success or just interested in slowing down and reversing the aging process, fertility parameters are excellent markers to measure where you are in your aging process. I invite you to call us at Dollar Wellness to inquire about how we can help you enhance your fertility and virility as a way to express your youthful vitality. I hope you have enjoyed today's Dear Dr. Mao episode. Tune in next week when I'll discuss preventing cataracts and glaucoma naturally. Until then, live long, live strong, and live happy.